Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today, we're talking with Dr. Lisa Duhaime of Peeples Cancer Institute in Dalton. Thank you for joining us today, Dr. Duhaime.
I'm glad to be here, Bobby.
Dr. Duhaime is a board-certified medical oncologist at Peeples Cancer Institute at 1215 Memorial Drive on the campus of Hamilton Medical Center. She specializes in adult cancer and hematology disorders. She completed her internal medicine residency at Henry Ford Hospital in Detroit, Michigan, and her medical oncology hematology fellowship training at the H. Lee Moffitt Cancer Center at the University of South Florida in Tampa. Let's talk about cancer. Are there ways to lower our risk of getting cancer?
There sure are. There are actually a lot of ways to lower our risk about getting cancer.
Now, what are some of those? What are some of the ways that I can decrease my chances of getting cancer?
The most important and obvious way of lowering your risk of getting cancer is don't smoke.
So many people have smoked, and, I know that that is decreasing. What about vaping?
You know what's really sad is my children in middle school were telling me that almost everyone in their class was vaping. And we do not know all of the bad side effects that vaping can cause. And it has been told to people time and time again. The bottom line is they are inhaling chemicals into their lungs. That cannot be good. When you're inhaling something that's not supposed to be in your lungs, into your lungs, and people are still doing it. They think, well, because it's not smoke, it can't hurt.
Yeah, because it's not tobacco, they think it's going to be okay.
And these are chemicals that you're inhaling deeply into your lungs.
Well, as long as you have middle school kids that are doing this, and you've got flavors like bubble gum and blueberry and cherry, all these things that I'm not saying they're gearing them toward children, but who else would want the bubble gum flavor?
Exactly.
You got so many people.
And not only that, but it's a setup for smoking in the future for them.
Well,
it starts them on a habit, using their hands.
Yes, and now they're smoking. Now they're smoking tobacco. And then if you look at the other side of the coin, a lot of people who smoke tobacco said, well, I need this to get off of tobacco. But that is not any better than tobacco smoke.
Exactly.
In fact, what we're learning today could say it might be worse.
We don't know.
We just don't know.
That's the bottom line, is we just don't know. But in addition to smoking, we know that alcohol excessive alcohol use will absolutely contribute to cancers.
Now, see, I did not know that. I know I've often thought of excessive alcohol use being liver issues and things like that. I had never thought about cancer.
So we know that smoking can be attributable to almost every cancer in your body. Mm-hmm. Alcohol use is associated with your head and neck cancers, gastric cancer, liver cancer, because it contributes to cirrhosis.
Alcohol.
Yes. And now we're showing that there's an increased risk in liver cancer in this country that's not associated with hepatitis. So non-hepatitis cirrhosis is increasing the risk of liver cancer in this country. So fatty liver associated with alcohol use and with obesity.
With obesity?
Yes. And there's actually data now showing that over 4% of cancer is associated with obesity. And we know that obesity is a major health problem in this country. And now we know that it's directly associated with cancer.
That is sad, because so many people have that issue.
And we know that it's directly associated with breast cancer, definitely, because fat cells actually help produce estrogen, and estrogen feeds the large majority of breast cancers. 85% of breast cancers are directly linked to estrogen production.
No, I did not know that either. What about that? Well, let's talk about sun exposure.
Thankfully, the younger generation has been raised to put on sunscreen. The generation of the 50 and 60-year-olds who used a lot of oil, and they just wanted to go out and basically sit in the sun with their oil and fry themselves.
Right.
And, that generation was still of the mindset the parents just let them go outside all summer without sunscreen. When you got into the generation of 30 years and below, that's the generation that we're seeing those kids have been protected more.
Well, you're right. And when I was a kid, I would just go outside.
Absolutely.
And I'd go outside from 8 o'clock in the morning until dark. And that all of my entertainment as a child was outside. And no sunscreen, nothing like that. And now I've got friends, and they have skin cancer.
And is skin cancer ever going to completely go away? No. It isn't, but I have yet to know and see whether we're going to see a true decrease in the incidence of melanoma. I'm hoping to not retire for a good 20 years, so I'll be interested to see if 20 years from now our melanoma incidence goes down.
Yeah, all attributed to skin cancer.
Exactly. Now, another interesting thing that is just coming out in the past 10 years or so, and certainly probably in the last couple years, we are seeing that infections tend to be associated with increased risk of certain cancers, especially in the colon cancer world. That's been big in the news in just the past year.
Infections?
Absolutely. Certain infections tend to be associated, and excess antibiotic use seems to be associated with increased risk of colon cancer. And it seems to be that so the colon is supposed to have good bacteria that helps us digest food. And when patients are given lots of antibiotics to treat other infections, it actually also kills off the good bacteria.
Wow.
And can help foster the growth of bad bacteria and therefore lead to cancer growth.
That never had crossed my mind. I have always heard, that you got to be careful when it comes to antibiotics. You don't want to get resistant to them. You don't want to take antibiotics for something that's viral,
The other infection that some people are not aware that is an infection and is absolutely 100% directly related to cancer is the HPV virus, the human papilloma virus. That is what causes cervical cancer. Cervical cancer is a cancer of infection. It is directly associated with the HPV virus, and now there's an increase in head and neck cancers in the younger generation because also the association with that same virus in the mouth area.
Now, there's a vaccine for that.
There is. And if parents get their children vaccinated the way they should, those cancers, or the cervical cancer, should be eradicated within the next 20 years.
Oh, that's wonderful.
Wouldn't that be a wonderful thing?
Yes.
One of the other infections that is definitely a direct association with cancer is the hepatitis B and C
Now, hepatitis
virus.
B and C virus is a cancer?
No.
But I mean, it can give you...
leads to liver cancer.
Oh, wow.
So hepatitis can lead to liver cancer,
Right.
or is a direct association with anyone who has hepatitis B or C. We monitor their blood work for liver cancer, especially if we know that they have long-term liver damage called cirrhosis. So someone who has cirrhosis from their hepatitis is at a very increased risk of developing liver cancer.
Is that a blood
hepatitis.
test?
Yes. It's called an alpha-fetoprotein blood
Now,
test.
when you take a blood test for cancer, are there markers that show up? How does that work?
Some cancers have what we call tumor markers associated with them, but it is not for all cancers. Lung cancer does not have a blood test. Not all cancers have tumor markers. Melanoma does not have a blood tumor marker. Brain cancer does not have a blood tumor marker. Lung cancer does not have a blood tumor marker. In all honesty, probably at least half or more of our cancers do not have tumor markers. Head and neck cancer does not have a tumor marker.
So that's why a mammography is so important.
Absolutely. Absolutely. There are actually the cancers that we actually have preventative test for is basically colon cancer. Get your colonoscopy, get your mammogram for breast cancer. Men can get PSAs for prostate cancer.
You had mentioned lung cancer. That is one thing that I have also always associated with smoking.
And that is actually, now we do recommend low-dose screening CT scans for some smokers who have had heavy histories of smoking. So if you've smoked more than 15 years, you've had so many pack years of smoking, you probably qualify for someone who should get a yearly CT scan of your lungs, because it has proven to decrease the chance that you will die from lung cancer, because we can pick up your lung cancer at a time that we can still cure it.
Well, is this for people that are still smoking or people that have stopped smoking?
Actually, we have shown that we should continue to screen people up to 15 years after they stop smoking.
Wow. But after you stop smoking, some great things happen to your lungs.
Oh, absolutely. Your lungs will definitely start to heal and improve as soon as you stop smoking. But, you have to imagine, Rome wasn't built in a day, and your lungs are not going to heal themselves if you've smoked for 25 years and you put down your cigarettes tomorrow. You can't undo 25 years of damage to your lungs and think that since you stopped smoking, you're never going to get lung cancer after 25 years of smoking. So you need to do what you can to monitor so that if there is something that's going to happen, you catch it early. But usually after 15 years, your risk of getting lung cancer is the same as someone who hasn't smoked, or close to.
That is wonderful news. So the lesson here is stop smoking.
Amen.
Dr. Duhaime, we've learned so much today. Thank you for being our guest on the show.
Thank you for having me, Bobby.
Glad that you're here. For more information or an appointment at Peeples Cancer Institute, call 844-PCI-HOPE. And to make an appointment for a mammogram, call 706-272-6565. To learn more about Peeples Cancer Institute, visit hamiltonhealth.com/cancer. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.